Body is just incredible. Hopefully you can hear me. I realized I should have brought a microphone. I can't even believe how far I've come from the beginning of all of this. The fact that I'm able to walk like this and get back to the gym, go back to swimming. I am so grateful. So nice to be able to walk on a beautiful day like this. And I just want to update all of you on how things are going and what I kind of wish I knew in the first 2 months and the obstacles that you go through during an ACL injury. So at this point in my journey, I'm trying really, really hard to go the non-surgical route. I'm not opposed to surgery, but if I can get back to most of the things without surgery, that would be my ideal situation. And just the fact of how much I've progressed in the last 2 months, I mean, we'll see how far I can get in terms of how far my body can get back to things like it used to be. And I'm not any competitive athlete, but I love to be able to be active, play volleyball, try new sports, try new things, dance, hike, swim, run. I like to be active. And if I can get back to most of those things, that would be amazing and an ideal situation. I feel like something people don't really talk about is the mindset of going through an injury. I wouldn't say that it's easy to stay motivated during this process. There's days where I'm like, I just don't really want to do anything today. I don't want to think about rehab. I just want to be lazy. And I remind myself to give myself some self-compassion with this process because it's not easy. And then the thing I find really helpful to stay motivated is to have milestones and goals to reach. For example, early in your recovery journey, you're trying to really just reduce swelling, get range of motion back, and then slowly be able to walk normally and with a normal gait. And then eventually, as your range of motion improves, we start to reach milestones like going up and down stairs, being able to do step-ups, being able to start jumping. Having goals to reach has been really helpful. And at this point in my journey, I'm past the walking stage. I basically got my range of motion back for the most part. My full flexion is not comfortably there, but if I push it can be there. And I'm back to walking, back to going to the gym. Obviously my injured leg is not as strong, but it's coming back. It really is. It's getting back comparably to my other leg. My stability is not fully there, but it's getting there day by day. And right now, my physiotherapist said I need to start teaching my body how to jump again. Oh my God. You cannot, I have to tell you, it was so mentally difficult. I had that huge mental block of being scared to jump because I haven't jumped for the last 2 months and jumping just seems such a high impact movement. So I started tippy-toeing, doing a bit of a heel raise, and then I did a little hop, just the tiniest hop where I felt comfortable. I would hold onto the counter or one of those elastic bands and just make it easier and more safe for me to jump, even though my physio said he's confident that I won't have pain, I won't swell doing this, and I really need to start reminding my body of those movements. And so that's the step I'm at right now. So it's really nice to be able to reach these milestones. I cannot wait till I can run and jog again. Not any lateral movements too much yet besides lateral step-ups. However, I'm really, really happy with where things are at. And a really important thing to note is you cannot compare yourself to anyone else. Everyone's journey is so different. I have a friend who, at the stage, she was already running. And month 3, she was back to sport, which is insane. I mean, we all react differently to injuries and we really don't know what's going on in there. So take your time with it. Don't compare yourself to everyone else and focus on that journey. It's all these new milestones that you get to experience for the first time again as an adult is exciting. I was so happy when I jumped, or even when I was able to walk down and up the stairs again. I have a different level of appreciation for movement. Something I found really helpful in my recovery, and I don't really feel like a lot of people talk about this, is learning how to have the best quality sleep, because our body heals when it sleeps, and you're going to feel so much better. Every time I have a good sleep, my body feels so good. And the things such as sleep hygiene, making sure to avoid going on your phone before bed, making sure to get some fresh nature and fresh air in the morning and throughout the day so that your body can get that cycle back. I forgot what it's called. It's like your circadian rhythm back into place. I feel like sleep is probably one of the most important things besides obviously mental health, nutrition, drinking enough water. But Sleep is extremely healing. So working on that has made a huge difference. Like anything else, recovery is not a straight line. You're going to have setbacks. You're going to have days that you feel terrible, but there are also days that you feel great. And you got to just trust the journey. I think confidence and believing in yourself goes such a long way. You got to hype yourself up. Like, you got this. You can do this. You're going to get better. You're strong. You're healing. Mindset is really important. And I'm thinking of this as a long-term thing. These changes I'm making is not temporary. I'm going to incorporate this, maybe not the intensity of rehab, but just taking care of myself, eating well, sleeping well, moving my body. All of these things are going to be things that I continue to do. So I'm taking small steps. Sometimes less is more, especially early in injury. I was trying to do too many things at once, and it takes time to make changes. So if you start small and focus on a few things, I think that might be better than trying to do the perfect thing. There's no such thing. Just keep it simple, focus on a few main things, and you'll get there. Also, don't be scared to try different physios. They can really make a difference. I recently tried another physio, and he automatically saw the compensations that I was making. I do think it's good to do functional movements like lunges and squats and those things, but I think isometric movements are also really important because we gotta compare the legs, right? How is your left leg doing in comparison to your right? So I found that doing single leg presses, single leg extensions, single leg curls can really give me a good comparison of how my other leg is doing in comparison to the injured leg. It's so easy for our bodies to compensate. It's insane. You gotta really have a good physio to see where you're compensating and what you need to do to not make those compensations over time. Something I also stopped doing is to research too far ahead. At this point in my recovery, I want to just focus on the now and what I need to focus on now. I want to have this injury take less space in my brain over time versus at the beginning of this journey, all you can think about is your knee. And I mean, I still wake up and think about my knee still, but I can see these thoughts slowly disintegrating over time and learn how to trust my knee again without overthinking it. Another thing that I've been doing is when I brush my teeth, I have an electric toothbrush and it basically buzzes every 30 seconds so that it tells you when you should move to the other side. And what I've been doing is every 30 seconds, I will balance on one leg, close my eyes, and just practice balancing with my eyes closed. It's so much harder. And after doing it for maybe a week or so now, I've gotten really good at balancing on both legs with my eyes closed. This is beautiful, by the way. Oh my gosh. Another important thing I really noticed during my recovery is starting to really increase the intensity of my workouts, because the way to prevent injury in the future is being able to have really good form when you're tired. That's what my physio said. It's like most of the time, athletes get injured when they're in the last quarter of the game and they push themselves and then their form is off. That's typically, I mean, obviously there's injuries where there's accidents that happen, but the non-contact injuries that you can prevent is being able to push your body when you're tired, but still having really good form. So in the next few months, I think I'm going to focus on really increasing the intensity of my workouts and pushing myself a little bit harder while being able to keep really, really good form. Another thing my physio noticed is when I do squats, one of my feet is slightly ahead of the other feet. And when I keep my feet even, it actually feels uneven. So I've been practicing trying to keep my 2 feet straight while my eyes are closed, because I'm trying to retrain my body on what is a good form. But because it's easy to look down and realize that it's wrong and fix it in the moment. But can I continue to have that form when my eyes are closed and I'm not thinking about it? That is the greatest challenge. And so randomly when I'm standing still, I'll look down and be like, is my feet normal? And then over time, hopefully this can retrain my body on what is the best form for injury prevention. Another thing I found really helpful, if you notice that one of your quads just look a lot bigger than the other, is a TMES machine or some muscle stimulation machine. I was using TENS. By the way, I realized there's a difference between TENS machine and TMES machine. Basically, TENS machine is really good at blocking those pain signals. So if you're in pain, TENS can help with that. But TMES is a muscle stimulator, so it actually helps activate your muscles, especially when you just got injured or just after surgery. It's a really important machine to prevent further loss of muscle. And I've been finding it really helpful just incorporating into my routine and adding it in. I just have a cheap one from Amazon, and I don't know, I feel like it works. I don't think you need an expensive one, to be honest. And it's nice that it's portable, so I can bring it anywhere I want. Bring it to the gym when I'm working at home. I can really see those quads activating. I do think it's important to listen to your body and don't push past too much pain, but also have a physio that can help you and guide you to do things to progress yourself a little bit further, because it's hard to know what's safe and what's not. I think I've walked like 2 kilometers now. So by the time I'm back, it would have been 4 kilometers today in this beautiful nature. I'm never going to take walking for granted anymore. Oh my gosh, it's so nice to walk and be able to move and be functional again. What a blessing. I'm trying to go the non-surgical route, but that doesn't mean that you have to. We're all in our own journey. Try to get multiple opinions if you can. I'll try my best to update you on how things are going month per month, because this is a long journey and I do want to be able to capture this recovery journey, which is why I started this YouTube channel, because I'm going to look back and be like, wow, look how far I've come. I just can't wait to run again. I feel this urge to run, but I'm not going to run until my physio clears me of running or jogging, not even running. But jumping is definitely an important. You've made it all the way to this part of the video. Thanks for listening. Thanks for being here. We got this. We're in this together, and sending you all of the healing energy. We will make it through together. I'm going to enjoy the rest of the walk in silence, and I will see you next time. Bye.